Good morning, everyone, and thank you for being here. Today, I will be presenting my research into the combinatorial treatment of HER2-positive breast cancer with trastuzumab. In the United States, cancer is the second leading cause of death, and in women in the United States, breast cancer is the second most common cancer. On the screen, you can see projections for the year of 2021, and from those statistics, it is evident that research into breast cancer is of importance due to the amount of women that will be diagnosed with and die from it every year. Breast cancer can be broken down into different subgroups, including invasive, non-invasive, and metastatic breast cancer. Those subgroups can further be divided into molecular subgroups, one being the human epidermal growth factor receptor 2 positive breast cancer, or HER2 positive breast cancer for short. HER2 positive breast cancer is distinguished by an overexpression of the HER2 protein, as you can see in the figure. And the HER2 protein is responsible for cell growth and proliferation. And when there's an overexpression of this protein, it can lead to malignant cells and ultimately tumor formation. Approximately 20 to 25% of all breast cancers are characterized as being HER2 positive. Now, to put this in perspective to the statistics shown earlier, more than 60,000 women in the year of 2021 will be diagnosed with HER2 positive breast cancer, making the HER2 protein an important therapeutic target. The extracellular region of the HER2 protein is accessible for targeted antibody therapy. One monoclonal antibody that binds with high affinity to the HER2 protein is trastuzumab, which can be seen on the screen. The exact mechanism of trastuzumab is unknown, but there are two main mechanisms it is believed to follow. The first mechanism is through antibody cellular cytotoxicity. In this mechanism, a natural killer cell, which can be seen in the center figure, recognizes and attaches itself to the antibody which is bound to the target cell. This then leads the cell into apoptosis. The second mechanism is through an inhibition of intercellular signaling. When trastuzumab binds to the HER2 protein, it interferes with HER2 dimerization. This leads to an inhibition of intercellular signaling and ultimately leads to cell cycle arrest. The objective of the study is to compare the effectiveness of trastuzumab in combination with other treatments. Specifically, we will be looking at chemotherapy, hormonal therapy, and one other monoclonal antibody that binds with high affinity to the HER2 protein called pertuzumab, which can be seen on the screen. This research will allow for a better understanding of how trastuzumab works and what treatments to offer patients suffering from HER2-positive breast cancer. For this literature research, SciFinder was used, and the keyword search dealt with trastuzumab's mechanism of action as well as trastuzumab in combination with the various treatments of interest. Because trastuzumab is used in various types of cancer, the articles were refined down to those specifically regarding breast cancer. Those articles were then organized by the number of citing references that they had. In this study, Calu-3 cells, which have consistently active HER2 protein, were injected into mice, and the size of the tumor was monitored over time. The mice were then randomly placed into groups and were either treated with a vehicle, with trastuzumab, with pertuzumab, or with a combination of the two antibodies. As you can see, with the mice that were treated with either pertuzumab or trastuzumab alone, there was little tumor growth. And for those mice that were treated with a combination of trastuzumab and pertuzumab, there was a decrease in tumor size. The results from the study can further be appreciated by looking at the size of the tumor for the various treatments in comparison to the vehicle. When trastuzumab or pertuzumab were used alone, the tumor size was reduced 62 to 65%. But when the two antibodies were used in combination, the tumor size was reduced to 97%. These results just scratch the surface of what trastuzumab can do in combination with other treatments. For patients treated with chemotherapy A, they either received anthracycline and cyclophosphamide or paclitaxel. Some of those patients were then selected to receive additional treatment with trastuzumab. For patients treated with chemotherapy B, they were split into two groups. The first group was treated with a combination of oral lapidem and oral capecitabine. The second group was treated with an antibody drug conjugate called T-DM1. An antibody drug conjugate is created by chemically linking a cytotoxic agent to an antibody. Our cytotoxic agent in this case was DM1, and our antibody was trastuzumab. For patients receiving hormonal therapy A, oral anastrozole was taken, and some of those patients were randomly selected to receive an additional treatment of trastuzumab. As you can see, in all studies, there was an increase in progression-free survival with the addition of trastuzumab to the treatment. In order to compare the effectiveness of the treatments, the increase in progression-free survival with the addition of trastuzumab was calculated. Overall, with the addition of trastuzumab, the progression-free survival increased from 50% to 100%, with hormonal therapy A exhibiting a 100% increase in progression-free survival with the addition of trastuzumab. In more human trials, the addition of pertuzumab to those combinations were investigated. For patients receiving chemotherapy C, docetaxel and trastuzumab were used. Some of those patients were then randomly selected to receive additional treatment with pertuzumab. For patients receiving hormonal therapy B, oral anastrozole and letrozole were used in combination with trastuzumab. From those patients, some were randomly selected to receive additional treatment with pertuzumab. In both studies, the addition of pertuzumab showed to increase the progression-free survival. Once again, in order to compare effectiveness, the increase in progression-free survival was calculated for these treatments. Interestingly, in this study, hormonal therapy B showed to have less increase in progression-free survival in comparison to chemotherapy C. In the first analysis, we saw that the increase in progression-free survival was highest with the combination of trastuzumab and pertuzumab, but we did not see this in the second analysis. This could be explained through signaling pathways. As stated earlier, both pertuzumab and trastuzumab bind to the HER2 protein, but they bind on different locations. By binding on different locations, this could lead to an increase in antibody cellular cytotoxicity or an increase in signal inhibition due to the interference with dimerization. This could explain the results we saw when pertuzumab was used in combination with trastuzumab. In addition, there is a suggested crosstalk between the pathway that trastuzumab utilizes, called the HER2 pathway, and the pathway that the hormonal therapy drugs utilize, called the estrogen receptor pathway. This crossover could lead to a greater signal inhibition when hormonal therapy and trastuzumab are used in combination. Now you may ask why we didn't see as big of an increase in progression-free survival when pertuzumab was added to the combination of hormonal therapy and trastuzumab. This could be because hormonal therapy and trastuzumab together were already exhibiting an increase in signal inhibition. With the addition of pertuzumab, it wasn't allowed to exhibit its full ability of signal inhibition. Now, the mechanism of trastuzumab and chemotherapy, on the other hand, aren't believed to have any crossover. So when pertuzumab was added to that combination, it was allowed to exhibit its full range of signal inhibition, leading to a greater increase in progression-free survival. Although chemotherapy in combination with trastuzumab exhibited a higher increase in progression-free survival compared to the antibody-drug conjugate, the antibody-drug conjugate allows for a more targeted approach to chemotherapy and could therefore reduce the toxicity seen with regular cytotoxic agents. This could be an important factor for patients to look at when looking at the various treatments. Overall, for this research, we saw that when trastuzumab was used in combinatorial treatments, there was a reduction in tumor size. Additionally, when trastuzumab was used in combination with chemotherapy in an antibody-drug conjugate, in combination with hormonal therapy, and in combination with pertuzumab, there was an increase in progression-free survival. If there were to be further research into the effectiveness of trastuzumab used in combinatorial treatment, it would be beneficial to have studies from the same time frame, studies with baselines for all treatments used, and studies with the same form of chemotherapy and hormonal therapy. This would allow for a more comprehensive comparison of the different treatments used in combination. I would like to thank Dr. Nguyen for all of her guidance throughout this project, and I'd like to thank you for your time.